So living with either von Willebrand's disease or Glanzmann's causes significant burden for patients and their family members, which we don't ask about and they don't tell us. So when you actually talk to people, they bleed far more than we know as healthcare professionals, but because they think we don't have access to the treatments that would stop them from bleeding, or because this is their normal, they kind of adopt a watch and wait situation. So they maybe will wait for several hours or even days while they're bleeding before they contact the treatment centres to come to get treatment. As a healthcare professional, I used to find that really frustrating because I was like, if you'd come quicker, we could have treated you quicker, we could have stopped the bleeding sooner. What I now appreciate is that actually, because this is so normal and because many people bleed every single day, they don't want to come to hospital every time they've got a bleed. So they carry on leading this life of normality to them, which would not be normal for you or for me. And that impacts on them significantly. So they talk about things like being concerned about going out in case they have a nosebleed and they're seen to be bleeding in public. For those that have very obvious bruising, they talk about being looked at by the rest of the community and the suggestion that perhaps there's non-accidental injury going on. And that means that they lead a life that is perhaps more isolated than you or I, and certainly not as spontaneous. Some of the other things that I've heard people with von Willebrand's or Glanzmann's talking about is the impact on life, not just for them, but also for their family. So things like not being able to go on holiday because they can't go to perhaps countries that they might want to go to. They worry that when they get to those countries, if they went, there wouldn't be access to treatment if they had a bleed. They worry about the impact of time out of school, time off work, and career opportunities. So many people say that they haven't gone down the career route that they might have done if they didn't have a bleeding disorder. And I think the impact is wider than just the individual with the bleeding disorder. The impact on family is huge, and we don't capture that in any way, shape, or form. So, you might have a sibling who has a problem with bleeding. That means you can't go either because actually your family want to treat you the same. So that means nobody goes on holiday, nobody goes to scouts, nobody does summer camp. That means the parents are also impacted by the child, or the children are impacted by the parents having bleeding disorders. And so they live their lives in a very different way to perhaps how they might if they didn't have that bleeding disorder, or they had treatment for the bleeding disorder, so they were less restricted.